Hey, in this video I'll discuss about DAS diet for hypertension or prehypertension. DAS, the full form is Dietary Approach to Stop Hypertension. Yes, this is a good balanced diet for hypertensive or prehypertensive to maintain his or her blood pressure. Uh, this DAS diet in one sentence, it is including potassium rich food and restricting sodium. So this diet doesn't mean you have to restrict all your animal fats, all your what you eat. It is not like that. You have to just restrict or control your diet. How's that? It's very easy. You have to incorporate potassium rich food. What are the foods that rich in potassium? Potassium rich food, firstly, fresh vegetables. Any fresh vegetables is rich in potassium, especially when it is leafy vegetables like spinach, etc. Different vegetables. Try to uh, incorporate leafy vegetables in your diet every day. It will be great benefit for your condition. And you have to restrict meat, red meat, chicken. That doesn't mean you have to stop it. Yeah, you eat it once or twice a week. And breakfast, egg whites, oats, brown bread, you can take it. And dry fruit, thrice a week. Dry fruit, cashew, almond, raisin, any dry fruit, they are rich in potassium, especially dates is also a rich source of potassium, so you can incorporate these things, dry fruits, in your diet thrice a day. Take every day. Date, you can take every day, and dry fruit thrice a week. And fruits, especially pomegranate, orange, kiwi, these all fruits are rich in potassium, so you have to take fruit every day. So after breakfast, uh, 3 or 4 hours, 2 to 3 hours after breakfast, you can take fruits, and in your lunch and your dinner, incorporate leafy vegetables and other vegetables also. And fish, if you are a non-vegetarian, uh, then you can incorporate fish thrice or fourth time in a week. The omega fatty acids that present in fish fat, it is very good for cardiovascular health. And in nuts or in your dry fruits, the walnut, it contains abundant amount of omega-3 fatty acids, so you can incorporate it in your diet also. So these are the things you have to keep in your mind. You have to take potassium rich foods. And one thing I forgot to mention, that banana is a rich source of potassium, so a small size banana you can take every day, 1 or 2 banana. And if and other things that is very important, to restrict salt. Don't add raw salt in your vegetable or anything. Don't use extra added salt, is harmful for your health, as you are prehypertensive or hypertensive. So extra salt, avoid it. And in your diet also, just restrict or lessen the amount of sodium that you intake. So these things you have to keep in mind. Your blood pressure definitely will reduce. So these all are the all about dietary approach for reducing hypertension or prehypertension. Thank you very much.